Hey guys, it's Steve Collins from the Joint Physiotherapy here. So I was just going through, we're going to be having a CPD session on pregnancy and training. So I just thought I'd go through the latest recommendations. So there's a 2020 WHO World Health Organization guidelines which have come out, which are these ones on the left here. If you want to download it, it's a freely downloadable resource. Page 47 is the one that we need, but it's just the new 2020 Physical Activity and Sedentary Behaviour Guidelines. So that's what we'll be covering here. And on the right-hand screen, we have the Canadian Society of Obstetrics and Gynecology and their 2019 recommendations, which a lot of these WHO 2020 recommendations were based off. So basically, just starting off, pregnancy, I guess it always used to be a bit of a no-no, pregnancy and exercise. You'll never ever find any randomized controlled trials on it because of the fact that it'll never pass a ethics board as to whether or not exercise is safe or beneficial in any of these conditions. But if it weren't safe, if it weren't beneficial, you would be seeing lots and lots of case reports of negative health outcomes, which doesn't exist in the literature. So therefore, it's kind of one of those ones where an absence of evidence is a bit of a evidence of absence of there being any harm. So what we do know now is that basically females during and post-pregnancy should be aiming to get to the standard recommended 150 minutes. Okay, so over here on this left-hand World Health Organization one, they should be getting to their 150 minutes of moderate intensity aerobic physical activity throughout the week. And 2 days of that should be strength training, whether or not it's in those 150 minutes or not, or separate too, but that's kind of the minimum, up to 300 minutes. And even if they kind of previously were doing vigorous activity, which is, if we look over here on the right one, it outlines kind of what vigorous activity is. Anything over 147 beats per minute for a female under 29 years of age, or 142 beats per minute, a female over 30 years of age, well then you need about half the amount of physical activity, so 75 to 150 minutes a week, again with the 2 days of resistance training. So we know there are a lot of positive benefits just from case study reports and cohort reports. So over here in this left one, we can see that, there's benefits to both the mum and bub, so decreased risk of preeclampsia. So a lot of your kind of blood pressure, major blood pressure issues that can come up with pregnancy because of the increase in blood flow and volume created. So got hypertension as well there. Gestational diabetes decreases. Excessive gestational weight gain is less of a risk, less risk of delivery complication, and less risk of postpartum depression, which is good, and fewer newborn complications. So there's no increased risk as well to things like stillbirth, which people used to think. So now from there, we have the recommendations here. So as I said, got to get up to about that 150 minutes. So if they're doing, say, aiming for those 3 classes a week, most people should cover that, which is good. And it says that they should basically, if you were doing vigorous intensity stuff within those heart rates that I kind of said before, then okay to kind of continue that. So it's not like because you're pregnant, you have to decrease the intensity of your workouts. But if you've just fallen pregnant, it's probably not the best time to start to try to get up into those vigorous intensity. It's probably better to kind of hang around it more in that moderate intensity type of work. And then, throughout your pregnancy, you are actually able to increase as you get fitter. So There are some other recommendations here. So basically of that, the most important one is that pregnant and postpartum women should be starting with small amounts of physical activity and gradually increasing frequency first, then intensity, then duration. Okay, so I know your classes are all kind of set times, so duration won't be increasing, but they should be starting to increase their frequency per week to get those minutes, okay, rather than before they increase their intensity. So unless there's someone who, again, was already doing that vigorous level activity, which was at over 147 beats per minute or over 142 beats per minute for a 30-year-old plus lady, well, then they should be kind of more sticking in that moderate zone and instead just doing more sessions per week. Once they've kind of upped the amount of sessions that they can do per week and they're tolerating that, then we go and increase the intensity and can try to push them into vigorous stuff. So I'll go through our little contraindications, and then I'll go through a little bit of the pathophys of kind of pregnancy and the things that we got to kind of, I guess, know about it. But we have absolute and relative contraindications. So just things that say, no, hey, you can't kind of exercise now. So ruptured membranes, premature labor. Hopefully none of us are trying to get someone who's just about to have a baby kind of, or who is actually like in the stages of labor exercising, other than the gentle kind of exercise that they're doing as part of their birth plan. Unexplained persistent bleeding. Again, all of these are medical kind of emergencies that you need to be going to their pregnancy assessment center. Placenta bravia, preeclampsia. So those high blood or low blood pressure, extreme low blood pressure issues, or extreme blood pressure issues in any way or shape or form. So you're looking for like dizziness, loss of color to the face, those type of things to let you kind of go, or, you know, this isn't looking good. This is something that's needing to be checked. Incompetent cervix. Again, we're kind of really making sure that they should have had all these kind of checks as they go, and they'll know these things. If they have any of them, then yes, they kind of shouldn't be getting involved in exercise that's not highly individualized and highly supervised by a women's health physiotherapist or their obstetrician. Any kind of stuff where there's issues with the way in which the uterus and placenta are growing, high order multiple pregnancies, so more than triplets, that is an actual contraindication to exercise, other than being able to do it with your physiotherapist or obstetrician. And uncontrolled type 1 diabetes, and that's just because of the blood sugar issues that we know could happen, where, you know, if they go in with it a little bit low, especially with their blood volume being a little bit more, they get an exercise, they'll use those sugars up more. It's more important when you're pregnant to be able to regulate your sugars well, because that's what feeds baby, that's what feeds you and your brain. And if they drop a high level, well, then we can be having issues like coma, etc. So we really need to be watching for that. And yeah, other cardiovascular stuff, but you should be picking that up on your pre-screening form. Relative contraindications, so it doesn't mean that they have to stop, but it's definitely something where you'd want them to be getting a clearance kind of prior. Relative recurrent pregnancy loss, so if they've had miscarriages in the past, definitely something you want them to get checked with. History of spontaneous preterm birth, and there's enough of those out there that's just something that if it's their second kid, worthwhile checking in with. Anemia, so lots of your ladies will have some iron issues. A lot of them should be taking some iron tablets if prescribed during their pregnancy, because again, it's one where your blood volume increases. So you need to make sure that you're also able to carry the oxygen around to all your cells and get that going. Hopefully you shouldn't have any malnutrition or eating disorders. Obviously that's out of all of our scope. That's something that if you are flagging that, you know, you do have someone who was previously really active, they're getting in, they're doing their exercise now, and you find that they're going through their pregnancy, but they're not really seeming to put on weight, and they're being really kind of, maybe they're coming to more and more sessions and trying to work harder, and you're just not kind of seeing that over a stage of pregnancy. You should be putting on an average of kind of 12 kilograms. If you're really not seeing that kind of gradual increase, especially in that second trimester where, you know, ladies start to show, well, then you should be starting to kind of just flag that there may be some disordered eating, and then, or just some body, if they have someone who's had previously some body awareness composition issues. So that's just something to keep in your mind, and if needed, flag a referral off to psychologist or GP. Twin pregnancies after 28th week, again, these things just get a little bit more risky. Your blood volumes go up a bit more. The pressure down on your organs and your pelvic floor is increased quite a lot there. And just cardiovascular disease or other medical conditions. So apart from that, guys, basically the super simple things that you would think with everyone. So, you know, you're staying hydrated, staying, you know, as cool as possible. Obviously they're exercising, so they will overheat. Pregnant ladies obviously overheat a little bit easier. Again, it's just because of the volumes of blood and etc. it's going around, and also decreases in lung volume, so they're struggling to kind of blow things off as well. Avoid activities so another thing that we have to watch is activities in the supine, so laying on your back position after the first trimester of pregnancy. Usually you can get away with a very small kind of amount of time, but you're just not wanting to lie on your back for too long because it blocks off the flow to your inferior vena cava, which basically the blood going and coming back from your lower limbs. Okay, so we don't want a lady laying on her back for long periods of time. You know, getting down for a very short period of time is okay. All ladies will kind of transfer from back to belly. They could still kind of do their bench press, that type of stuff, as long as they're not having to lie down for a long period of time. You know, less than a minute up, they should be fine. So anything high impact stuff coming into that kind of third trimester, it's definitely easing off the impact. More so, this is a musculoskeletal thing about watching the pelvic floor. Okay, so just, you know, that's the thing that we're wanting to protect as the lady starts to show more, as pressure from bub starts to go down a little bit more into things. We're wanting to decrease the impact and instead use some of those things that I talked about in my earlier PD with you guys of, you know, if we're decreasing the relative external intensity of something, so the load or the height of jumps, those type of things, well, then we're going to increase the internal intensity. You know, we can make them hold positions a little bit longer, so they're getting still the burn, still the training effects, still all the beneficial effects, but they aren't putting that extra musculoskeletal pressure on their pelvic floor. And then we should be doing pelvic floor muscle training on the daily. And so that should be kind of assessed and guided by a women's health physiotherapist. Basically, you know, a lot of your gentle cues. The pelvic floor is a very gentle muscle activation. Often ladies are better at describing it to ladies. So using things like cues of lifting an elevator from floor 1 or from ground floor up to floor 1, or gently stopping yourself from passing wind are some pretty good cues, and just doing that in kind of all fours in like a cat-cow position, and getting them to practice that, getting them to practice that in a sit-stand, getting them to practice that in a wall sit. Those type of things are good ones that you guys can actually do to make sure that they have their pelvic floor ready and prepared to get in and actually do the exercises in your class, the less controlled exercises. So, you know, they could do some warming up pelvic floor stuff in 4-point kneeling, warming up pelvic floor stuff in like a bit of a wall sit, warming up pelvic floor in a sit to stand. So that way that they know that they got it kind of down pat. Always questioning around kind of incontinence stuff if they are getting, and obviously this is something that you do more in private, just, you know, bringing it up in the most appropriate way possible. Just chatting about, like, you know, if they are having any incontinence issues, it is something to get checked out, not to just kind of let go on. Cool. So that's the main stuff there, guys. Now I just want to quickly go through a bit of the kind of the pathophys of pregnancy and the different kind of stages. So in that very first trimester, it's a bit of a catch-22. If women don't get really bad morning sickness, then actually your body goes into this little phase where it's hyper producing your red blood cells to start to kind of fuel the development of the fetus. So ladies, actually, if they don't get morning sickness, they actually have greater cardiovascular endurance in this time, because it's almost like they're artificially blood doping. So they have higher blood volumes, higher levels of red blood cells floating around in their system. So their cardiovascular endurance actually improves in this time until such time that they either start kind of putting on more weight, in which case, you know, everything's relative. So even though their oxygen carrying capacity is a little bit better, they're also got more tissue because they have some tissue from baby to actually carry it around to. So that's usually by the end of the first trimester, those benefits have gone, but most ladies unfortunately don't get to see those benefits because of the fact that they have morning sickness, which can be all day sickness as well. So it's just working around those times for your pregnant ladies. Just give me a second. I'll just put this on pause. The other things that we got to watch, guys, is what's that, sorry? Can I have about 5 minutes? Cool. The other thing that we got to watch, guys, is our breathing. So as we're getting kind of second trimester, getting further into our third trimester, what's going to be happening is basically bub is growing and is pushing up on our diaphragm. And so we're going to be unable to take those big kind of belly breaths that we require to kind of oxygenate our cells properly. So our body goes into a lot more of that anaerobic system, so that kind of lactic acid system a little bit earlier. So you'll find that your aerobic endurance stuff, you'll either have to decrease the external intensity, or they'll just reach those vigorous heart rate zones at a lot less level of intensity than what they used to get into. Biomechanically, most women around towards end of second trimester, start of third trimester are needing to change the way in which they are moving as well. So obviously biomechanically they anteriorly pelvic tilt a lot, okay, and they have to make room for having something kind of a bub there in the middle. So usually you're having to progress into more sumo based things, sumo squats, sumo deadlifts, those type of movements. So usually as well, this is a time when lower back pain and SIJ pain can be common. So you're just watching things with big, high kind of splitting of the both legs, because also the hormone relaxin right at the very start, and then kind of from this period in pregnancy is going into overdrive. So it's making the hormones making the ligaments around the pelvis separate a bit more. So you have a little bit more instability in the pelvis. So ladies may struggle in this stage unless they're previously really fit, and then they may even struggle if they were fit to do what they could do, say same height of box step ups, same length of lunges, those things. So you just might have to bring in the or bring down the height of the box, bring in the length of a lunge, get them to do lunge pulses or something instead, just so that way they are able to kind of not put as much stretch on those ligaments. And the other thing so early in the phase, when that relaxin hormone's going, the other thing we have to watch is if they're not getting bad morning sickness. Say, yes, they got awesome cardiovascular endurance. So, yep, they're cool. They want to go a bit more running or cardiovascular work because they can, but they're also more susceptible to things like your overuse, kind of connective tissue injuries. So your plantar fasciitis, your tendinopathies, those type of things, or more so your plantar fasciitis, just because things aren't quite as tight all the ligaments in your feet, etc., aren't quite as tight. Everything has a little bit more give in it that they're going to be, and their hormonal profile isn't as nice for kind of recovery, that, you know, you just have to watch out for those type of things. So instead of just letting them push their cardio like crazy, again, it's just slowly increase by increasing frequency, then increase intensity, then increase duration. So that should cover most things, guys. If anyone has any questions around that, just let me know, but hopefully that should cover most things. And then for ladies re-entering back in after, I always recommend getting it assessed by a women's health physiotherapist. First of all, usually it's 6 weeks out of training, and then starting back into more so controlled things, and then at 12 weeks into more chaotic things like your running, etc. Most ladies are having to do some pelvic floor stuff on the kind of few times a day. And then again, it's those same recommendations where you guys can be introducing, getting them doing pelvic floor work kind of prior to their workout in different positions that are going to be specific to their workout. All right, guys, if you have any questions at all, just let me know. But it's a great, they're a great group of people to be training. I loved working with my pregnant athletes. Yes, so you can make a huge change if you can keep someone active during their pregnancy. Their pregnancy is generally a lot better, and the outcomes for them and bub after pregnancy is generally a lot better as well. So definitely a worthy cause if we can keep them training. If you're having any issues, just let me know. Bye. Cool. Thanks, Kate. No, you're right. I was just doing the thing for fitstop. So it wasn't anything major.
Are you on someone or are you recording? I'm like, am I completely blown
No, it's just a recording for. Oh, okay. I'm still recording the meeting.